Good morning, good afternoon, everyone, and welcome to our second Global ACARE Congress, Adherence to Treatment, Global Challenge, Tangible Solutions. My name is Matthias Mueller, and I'm the Divisional Vice President of Innovation Development at Abbott's established pharmaceutical business. It's an honor to open this important virtual Congress, and I want to extend a warm welcome to the more than 51,000 registered healthcare professionals from around the globe joining us as we embark on a joint mission to crack the code of adherence. Building on the success of our first Congress on behavioral science and adherence in 2021, we've scaled up our efforts. Nearly 50 internationally renowned speakers will join us in the coming days to explore the hidden factors behind non-adherence and dive into solutions. We are running 5 regional events that complement our global Congress and combine local and international considerations and expertise. Non-adherence to treatment is a massive medical challenge, preventing people from living their healthiest lives. At Abbott, as part of our relentless work to support people to live healthier and fuller lives, we are committed to addressing non-adherence as a critical health challenge. It's time to shift the thinking from treating disease to treating people, and to take a cross-discipline approach to understand the multifaceted factors behind non-adherence. That's why we've built ACARE, by fusing advances in digital tools and behavioral science. We are taking a unique approach to support healthcare professionals and empower people to take small, manageable steps to improve the way they follow and keep up with medical treatments, so that we can help them live better. It is now my great pleasure to turn the floor over to Professor John Weinman, who is recognized as one of the founders of modern health psychology. He's a professor of psychology as applied to medicines at the School of Cancer and Pharmaceutical Sciences, an emeritus professor at the Institute of Psychiatry, Psychology and Neuroscience at King's College London, and a co-director of the King's College King's Health Partner Center of Adherence Research and Education. It's a privilege to have John chair the event again this year. Thank you very much for that. I wish us all now a very fruitful, constructive, and engaging Congress over the next days, and hand over to John. Thank you very much.
Thank you, Matthias, for that great introduction and for really setting the scene for this Congress. And it's really my pleasure and great honor to be the chair of the Congress again this year. The first Congress last year was a tremendous success. It involved experts from many areas of clinical medicine and behavioral science, and provided the audience, a large audience, with many insights into the different causes of non-adherence and the different sorts of strategies, both in terms of communication with patients and with digital options to support adherence. And I think people learned a lot from the sessions last year. But this year we're going to really continue this theme of exploring the causes of non-adherence and the behavioral science solutions in much more depth now. And so let's really look at what we're going to be doing this year. Today we've got essentially 3 broad areas we're going to explore. We're going to be looking at adherence, the complexities of adherence. We're going to look at the shift in paradigm from treating disease to treating people, which is really going to be an absolute core theme of this year's Congress, and to get a view, as it were, from the patient perspective as part of that. A key feature this year, which is new, is that we will have these global sessions, for example, as today, but we'll also have 5 satellite groups who will be feeding in and developing both their own solutions and working out solutions with us as part of the great challenge of trying to understand and deal with adherence. And so we have 5 satellite groups, as you can see on this slide, from the Middle East, Turkey, Africa and Pakistan, from India, Asia Pacific, Latin America and Brazil. And so great welcome to you all. It's wonderful to have you as part of this Congress and to be much more regional in our approach. And this will be very much seen in how we work next week on day 2, because in addition to having our global experts, we're going to have key healthcare professionals from all the satellite regions, and they'll be feeding in reflections on their best practice and how they work and what would work well in their own situation. And all of this will be leading really to help us understand and manage adherence as a major public health priority. This is something we're going to come back to and emphasize both from a global and a local perspective.